History was made when Simone and Thomas Key's twins were born 95 days apart. Timothy was born first, weighing just 1 pound, 15 ounces. His twin Celeste stayed in the womb for 3 more months. She was born weighing 5 pounds. And in Florida, these triplets were born 3 weeks apart. Kennard was born first, weighing about 1.5 pounds. Then his mother, Delvonda, was given medication to stop the labor. And 3 weeks later, Bernetta and Bolden were born. And Libby Starnes' triplets were born 11 days apart. Her doctor felt that stopping the labor would give her 2 unborn babies a better chance of survival, and it did.
It did. They were a lot better off, 1/2 pound heavier, and had much less of a struggle in the beginning.
So the first child was born
at 26.5 weeks gestation, 13 weeks early.
Wow.
And she weighed 2 pounds, and she needed oxygen for a couple of months and had numerous blood transfusions and an eye disease that could cause blindness and all of the things that anyone who's had a premature baby knows are risks. And 11 days made a big difference. They were, one breathed room air from start. The other one just needed a ventilator overnight. And they were in the hospital 66 days versus 81 days for the first baby.
Wow, what a trying time for you.
They continued to grow a lot faster.
So, okay, so you're in labor. Doctor explains this to me. Let me introduce the doctor now, if you have the doctor's introduction up there. Dr. Victor Klein says he's delivered 52 sets of triplets, more than any other doctor in the country. He's also delivered 4 sets of quadruplets, 1 set just a few weeks ago, and he's with North Shore University Hospital in New York. Now, is it different delivering multiples than delivering singles?
A lot different. Multiple pregnancies are usually a high-risk pregnancy. We see a lot more than we used to. Twins are pretty much commonplace, but triplets, quadruplets, and higher multiples really mean a lot of care both for the patient as well as for the physician.
Really? Now, what is this about stopping labor?
Well, we have medicines for the last 10 or 15 years which can stop labor. So years ago, 20, 30 years ago, a woman would go into labor and she would deliver, and that was it. Now we can give medicine which can hopefully stop labor for a short period of time or even for a great period of time in which they can deliver a close to term or a term baby.
So the first one comes and you then, after the first one's out, you give her medicine? Is that what happened to you, Libby? You take the medicine and then what happens?
Well, I was in preterm labor. My doctor was attempting to stop all 3 babies. So I got on the medicine. I was admitted on a Saturday morning, and by the time it was effective and my labor was stopped, the first baby was just too far into the birth process to stop. And so when I delivered her...
That baby said, "I'm coming now."
She did, and she hasn't stopped going since.
Singing Diana Ross's song, "I'm Coming Out."
Right.
Yeah.
So I was already stopped for 2 days when I had her, and the other 2 just stayed where they were.
So you've delivered more multiples than anybody in the country. How is that? Do people just know you're the multiple doctor man?
They keep on coming. It's a great job and it's great fun. But the problem you have is that there's a lot more high risk than people realize, and we get a lot of excitement when someone will deliver triplets or quads or quintuplets close to term and babies do great. But there are a lot of sad stories also, which, you know, multiples can be lost or they could be delivered very early. In the case like Libby's, you know, she was at high risk for an infection. So even though we took the risk, her doctor took the risk with consultation with the parents, you know, you had the risk that she could have had a serious infection, perhaps lost the rest of the pregnancy, or even she could have been sick herself.
Wow.
So the risk-benefit ratio in obstetrics and multiple pregnancies.
Next, the controversial issue many face when they learn that they are carrying multiples, and something most of us have never seen before, triplets being born.